Welcome, everyone. Welcome to Black Man Speak. I'm your co-host, the J.R. Stewart.
And I'm your co-host, the Tommy D. Duncan III, otherwise known as TD3. It is Wednesday, February the 5th, the first Wednesday of the month. And Jimmy, if it is Wednesday night,
Certainly, Black Man Speak. If you haven't already, hit the notification bell so you'll be notified when new shows are uploaded, which is every Wednesday at 9 p.m. Once the show concludes, the 5 different streaming platforms. If you haven't already, please hit the like button to help us with the algorithm. And if you're here watching the show live, invite a friend, family member, co-worker, neighbor, so you guys have something interesting to talk about for the rest of the week. And Tom, what do you think about the new theme, man? The music from Count Basie. Is that
oh, that
going
was
too far back?
it sounded pretty familiar. I couldn't tell who that was, and that was Count Basie, one of my old favorite from the pure blue blood days of jazz. So yeah, that turned out pretty nice.
Okay, so I didn't know if I went too far back.
Yeah, hey, I like the old school jazz.
Okay, yeah, there's something about that genre that's very special. So, Tom, I hear that we have a very special guest, so we're going
Yes,
to
we
get
do.
to quickly. So, we're going to do what we do best, which is bring information about the Black community, business information, history, current events, world history, world civic events, domestic civil events, and even legal matters and technology, sports. So we bring it all on this show. There are no taboo subject that we don't talk about. So with that being said, Tom, like I said, let's do what we do best, and let's proceed with the show, and then let's get to our guest.
All right, that sounds good, Jimmy. And happy Black History Month for everyone. Of course, people like us, we celebrate our history 365
Yeah.
days for the year. But, we do have to acknowledge that we do have a Black History Month that is in February. So, of course, we'll be kind of putting in a few things here and there that you may or may not know about. So, welcome, welcome, welcome. Want to acknowledge cousin Audrey K on the chat line. So if there are anyone out there who's listening who'd like to get on the chat line, ask a couple of questions.
Ask your questions early, Tom. Tell me to ask early.
Yes.
We
Make sure
have a
you do
great
not
guest,
wait.
lots of information. So you guys pick her brain, get all the knowledge out of it that you can, because we can't guarantee when she's going to come back.
This is
Although
true.
she will be back at some point.
Absolutely. So, with that being said, Jimmy, we're going to go ahead and move forward with our special guest for this evening. First and foremost, I'd like to introduce a colleague of ours, a friend, someone who is a native of Texas but has roots in the Caribbean, and who is a brilliant, brilliant sister who is going to share some information with us tonight regarding your health that will impact your family, that will impact your personal life. She focuses and has a pretty broad experience in the healthcare industry, but focuses on medical insurance and Medicare, even though she has done a lot of other things. So without very further ado, I would like to introduce to everyone Miss Cheray Scott. Good evening, good evening, good evening.
Hey, good afternoon, good evening, good evening. Thank you, Tommy. Thank you for Mr. Stewart for allowing me to be part of
Oh, you don't have to
your
be so
Black Men
formal.
Speak
It's
event.
JR for you.
JR.
Yes. We're family.
So at any rate, yes, Miss Cheray is a specialist in healthcare and also an entrepreneur and a business owner. And one of the things that JR and I are intentional about focusing on more this year is bringing more entrepreneur, more business owners to their race, so you can not only learn about specific things that are important to you, but also help introduce a lot of our friends and family to business ownership, entrepreneurship. That's something that she can speak to on both ends. So without further ado, I'm going to have Ms. Cheray tell us a little bit about herself and what she does, and then we will get into the subject matter for this evening.
Yeah. Good evening, good evening. And thank you again for letting me be here today. I, for 31 years, maybe over 32 years, I've had a license in insurance, and that's how I started my actual career, captive, working for a company. And I started in this career, I started with Medicare. And so I was fortunate to be a top rep inside sales and then outside sales. And then I was working there for probably about 11 years before I moved and shifted into home health I was a representative for home health for years, where I became a top rep and then a mentor trainer in that arena. Have also shifted to be work in hospice and a director in medical labs. So I've had a lot of experience in insurance and in healthcare in Dallas Fort Worth. 4 years ago, I decided it was time for me to go into business for myself. And so I've taken my knowledge and my license to become a broker and do insurance. And then my experience with healthcare and all other realms has kind of given me a culmination of experience to help me with what I do today. So I owner of CES InsureWise, and May will begin my 5th year being self-employed. But again, 31 years experience as with insurance, and then a lot of experience just seeing how this works, what doesn't, as I've been in when I was in medical sales. So,
Okay.
And before we get into healthcare insurance and Medicare, tell us a little bit about what the biggest difference is for you, since you've been on both sides, working for someone else and now working for yourself. Help me understand, Cliff Notes, how that transition worked and the biggest difference of having worked in a corporate environment and now being your own boss, being an entrepreneur. Just for our folks out there who may be thinking about it and, they don't know what they don't know.
okay. I will say, when I was an employee, and luckily for most of my career, I've been a top rep, I transferred a lot of my skill set over to personal. But what is important is that you have to be consistent. You have to be focused. You have to be consistent, and working for yourself. There's no coasting. There's no coasting. You are the chief cook and bottle washer, where I make the sale. I help consult with the client. I service the client. I help expand and do marketing for my business. And so it's a little different because it's all on me. But I do believe, when I was a top rep and when I was a mentor trainer, I would say that people who are in the companies working and consistently and doing things and managing their clients, they treat it, working for someone else, as though they're working for themselves. And if you have that type of work ethic, and belief in yourself and your product, you can transfer that skill set and that same work ethic, which is needed to be able to do it for yourself, and then build it.
So, Ms. Cheray, I'm a very simple person, so you may have to give me a very simple explanation. What exactly do you sell? And what's the product?
So thank you for asking, and let me clarify that I'd like to rather say
Don't
that
take
I'm
it over
more
my
of
head
a,
now. Keep in mind, I'm a simple person now.
right. So I'm really not selling anything, but I'd like to say that I'm serving the community and educating people about what is needed is understanding and clarification about insurance. My main focus on insurance for my practice is Medicare. So this is insurance for people who are 65 and older or
Okay.
disabled. And so that's the nucleus of what Medicare insurance covers. Since I started with that, I have expanded to do insurance for under 65, life insurance, critical needs. There are other aspects that I recognize people need to understand and people need to plan and prepare. So
Okay.
that is what I focus on. But I would say I'm more of a consultant. And then in consulting, I would talk to people about their needs, where they are, their budget, their doctors, and different things. And then I give them solutions. So that is primarily what I do.
Okay. Thank you.
Mm-hmm.
So tell us a little bit about Medicare. I think practically everyone has heard of it before. Some folks obviously use it and need it, and other folks just know about it, but they don't really know how or why it's relevant to them. So give us the big picture of what
Okay.
Medicare is and what it's all about. We know obviously it's
Okay.
obviously about health insurance.
Right. So Medicare was developed in 1968, and it was designed to be the insurance for people who are 65 and older.
Mhm.
As the years went on, it also now has become insurance for people who, as I said, are disabled, legally disabled. What that means is that you have to have a disability. Your doctor has to be able to sign off that you are disabled for 2 years to be able to qualify from Social Security to get Medicare early. So there are people who are 65 and older, and some people who get Medicare disability, and they qualify for Medicare benefits. So with that, what was designed in 1968 was just the basic Medicare, and basic Medicare has two parts. Part A is hospital, Part B is medical. When we work, and my son had told me one day when he first started working, what is FICA? Well, FICA, the taxes that they're taking out of our check, goes into pay towards Medicare. But people believe that that covers everything, and it does not. So FICA covered Part A. So if you work for 10 years or 40 quarters, 10 years or 40 quarters in the United States, that qualifies somebody to earn Part A. Part A covers hospital expenses for Medicare. Part B is another component that's mandatory for people with Medicare, and you don't get that at cost for free. Some people believe that FICA and the Social Security covers everything, but it doesn't. Part B, we pay for. In 2024, Part B cost the seniors $174 a month. This year, it's $185 and some change a month. When Medicare started years ago, Part B was $3, but each year they increase it. So it's a combination of Part A and Part B that gives us traditional Medicare. I want to show you all something. Even with Medicare A and B, it only covers 80%, and that leaves people exposed 20%. So
Okay.
with all of that I said, Part A you earn, Part B you pay for each month, Part B. It's only, if you're on Medicare alone, you're only getting coverage 80%. 20% you pay for. When I started 30 something years ago, people would say, oh, I have Medicare, it's no problem. But if you go see a doctor, 20% of a doctor's bill, even 20 to 30 years ago, wasn't much. But 20% of a doctor's bill today still may not be much. But if you go get an MRI, a CT scan, emergency room for a day, hospitalization, 20% is a lot. So this is where we have to solve the problem. What's going to pick up? What can I provide to the client that picks up this 20% gap? I also do want to point out that traditional Medicare does not cover dental. It doesn't cover your drugs. It doesn't cover eyeglasses. And then some of the options we'll talk about later do cover other things such as over-the-counter and health club memberships. But traditional Medicare doesn't cover any of that, and it leaves people exposed to pay 20%, and there's no ceiling. So if some people used to say, I'll just stay with traditional Medicare, but then you're at a risk that if you're in the hospital, there's no ceiling. You could end up paying thousands and thousands of dollars with no maximum out-of-pocket ceiling that most insurance plans have. So that's the basics of Medicare. Is everybody with me on that?
Yeah,
Yes.
and that's the primary difference with what folks who are an employee working for a company and they have private medical insurance. That the big difference between that and Medicare. And typically with private insurance, you have a deductible, you have a out-of-pocket maximum, and that is not the case with Medicare. Correct?
Well, correct and not correct. On traditional Medicare, no. On the options that I help people with, there are options that there's one plan or one option that mirrors the kind of narrative or the same type of direction that people had from companies. So, Mr. Stewart, were you all able to pull up that PDF? Was it something that you were able to get or no?
Let me check again.
If not, let me just say, there's two options. There's two options with Medicare.
So no, I wasn't able to pull it up. I'm sorry.
Okay. So let me just go back. So Medicare alone doesn't cover everything. So with that, you've got two options. You can, I think most of us may remember, maybe for our grandparents or even our parents back in the day, there was an option that was called a Medigap policy, or it's also sometimes called supplement policy. Medigap meaning it was to pick up the gaps that Medicare did not cover. Again, this visual does make sense. That pie kind of shows you that leaves you pretty exposed, right? So the Medigap policies were the traditional option that we had, only option they had about 25 years ago. And with that, if you choose that option, you will pay an additional premium for a supplement. And you would have to pay for a drug plan. Medicare now has a drug plan that was brought up by President Bush in 2008. The Part D drug plan was developed. And so at that point, people had to, it's mandatory that people get a drug plan. If they don't get a drug plan, Medicare imposes a penalty on a person, and that penalty is charged each month until they actually get Part D. So they prefer that people do get Part D. But so a supplement and a drug plan is one of the options that people can do. Now, what's the benefit of buying a supplement and the drug plan? Some people like the idea of a supplement because there's no network. You can go to any doctor from Houston to Dallas to New York to DC. And with the Medicare supplement, you have that freedom to go anywhere and there's no network. When you pay that monthly premium, that premium with a supplement, they have several different plans within the alphabet, A, C, G, F. The plans that are most comprehensive cover most everything for you once you pay that premium each month and pay Part D. The challenge is, just like our house insurance and our auto insurance is going up every 6 months to a year, the supplement prices go up. So it is not a locked in set price that you can count on that price staying that way. And they may start off at a fair price. In this Dallas-Fort Worth area, Plan G is one of the most comprehensive plans. Generally speaking, depending on your zip code, they cost about $180 a month above what people are paying for Part B. And you pay for a drug plan, and it starts at $180, and I've seen some people paying as high as $650 a month as far as how high the supplement prices go for each month. So that has become a cost prohibitive thing, and people need to understand that when they choose that option. So there's another option, and the other option mirrors what we had in companies. And they tried to make it simple so that, Tommy, as you mentioned, there's a plan that has the idea of a deductible, a co-payment. When you go see a doctor, you pay a co-payment, that type of thing. Most of these plans, they're called Medicare Advantage plans. And that's what you've been seeing on the commercials. You see that every year now, around October to December. Medicare Advantage plans are another option. This option for most Medicare Advantage plans have zero premiums or low premiums. And when a person chooses this option, they don't pay monthly, but they pay a co-payment when they see their doctor. Most of the plans have a zero premium for the primary, for your PCP, primary care physician. But most of the plans will have a co-payment for a specialist. Depending on the plan you're on, it could be $15, $20, $30, or maybe $55, depending on the option. But this mirrors what we used to have at a company. That mirrors what we used to have at a company, and those are called Medicare Advantage plan. The nice thing about that plan is that, as you can tell, instead of paying an additional premium each month, you have these plans at no cost or low cost. And when you have that, and most of these plans have no deductible for your doctor, your hospital, your medical. And you pay zero to the primary and low cost to the specialist. If you go to the hospital, there are payments. And if you go for MRI, CT scan, there's a co-payment. And they have a gap, a stop loss, a maximum out of pocket, so that if you had a catastrophic year where a lot of things were going wrong, you actually have something that protects you in that year. You wouldn't spend any more that year. United or Humana or whomever would cover you, and that would be covered for that year. And the following year, you start again. This particular Advantage plan, I want to say, is an extension of your Medicare. As long as somebody has Medicare A and B, there are no health questions asked. It's an extension of your Medicare. It's another option. And what they'd like us to explain it as is that United or Humana or Aetna or Cigna becomes the administrator of your Medicare benefits if you sign on and join this program.
So let me ask you this, just to make sure I'm clear, because you said a lot there, good information. You have Medicare A and Medicare B, which is Part A is hospital, Part B is medical insurance or medical services. But Medicare Advantage, if I understand you, Part A is free or not free?
You earn Part A from
Okay.
working 10 years or 40 quarters in the United States. So if you have a parent that's, foreign and did not work 10 years or 40 quarters, that could be a time where someone did not earn Part A. Or you have a spouse whose husband worked and the wife was working at home. She's a homemaker. She doesn't have Part A on her own, but she can utilize the fact that her husband worked as a married person.
That was I was going to ask.
Your Part A, you could earn it from the fact that you were married and you got that.
So that was another question I had kind of layered in.
Yes.
So I don't get off track. If you're married to someone and you're a senior, one of the spouses worked 40 quarters or 10 years, they have the benefit of having Medicare, then their spouse is covered?
That is correct. That is correct.
Medicare B requires a monthly premium, right?
Part B. Yes, Medicare Part B requires a premium. Now, there's a caveat to that. If a person has Part B, but they're low income, the low income subsidy can pay for a person's Part B. There are caveats. If somebody's lower income, they don't have to pay for Part B because the subsidies of Medicaid, and there's different levels of Medicaid, but they could get their Part B paid for from that. Other people who don't qualify for Medicaid generally pay this year's $185. There's also a situation where based on your earnings, a person could pay more for Part B. And sometimes people will pay, because they're high income earners, as high as $450 to $480 each month this year for people who have high income. I don't want to get too much in the weeds of that, but that is important to know.
So hey Tom, let's put Ms. Cheray's contact information. This is a lot. I don't know how people navigate.
I know it's a lot to unpack. And you know what?
They need an expert like you to come personally coach them on what to do and all these different decisions, because you can easily get lost in the minutia of all this, trying to figure out all these different plans and letters and.
Right. So there. Let me make sure that I kind of wrap around on this. Medicare Part A, you earn that if you've worked at least 40 quarters, 10 years. Medicare Part B is a premium with the caveat, if you are low income, then that could be subsidized. Now, in order to be eligible for Medicare Advantage, do you have to have Part A and B to be eligible for Medicare Advantage?
You do, because Medicare Advantage is paid by the fact that you have Part A that you earned and Part B that you pay for. So that's how the program is funded. They pay United or Humana, Cigna, Blue Cross. They pay that company. Medicare takes the money and pays United or whichever one each month on behalf of a person, as long as they have A and B. And if somebody forgets to pay their Part B, then they're dropped from their insurance.
Ouch.
Because
that's
what funds the Advantage plans.
Is the drugs included with Advantage, or is that just Part B?
Yes. That's a good point that I forgot to go ahead and to go into next. With the Advantage plan, you've got your hospital coverage, you've got your medical coverage, and you have your drug plan all in one.
Okay.
And so the all in one is an Advantage plan, which they also call Part C. They started confusing people a couple of years ago, throwing out, now you need Part C. It's confusing clients. And with confusion, and especially our seniors who are getting older, sometimes forgetting, it's a lot of confusion. They find a way. It's kind of like the old acorn and the bean. They confuse people so much they don't know. They don't know. But as long as they have A and B,
Mhm.
they're eligible for an Advantage plan, which covers everything, hospital, medical, and Part D. No additional cost for Part D. All in one.
Part
And
D
that
is
all in
drugs.
one is an Advantage plan, which is also called Part C.
So Part D is drugs or prescriptions.
It is Part D is drug. You're gonna slap me a little bit here because my I need to get my charger cord because this thing. I'll be right back. Okay.
All right, all right. And this is great information,
So
folks.
do your recap, Tom.
Yeah,
So part A, Part B. You got a Part C now. We're up to Part D.
yeah,
I think she even mentioned a Part G at some
yes,
point.
you did.
Do we skip over E?
We did not- we haven't gotten to E yet. I didn't hear E, but I think there was a G.
Well, okay. So with the
E
two
and F.
options,
Otherwise, Jimmy said, "Where's E and F?"
yeah, actually, one of my colleagues calls it the Medicare alphabet soup, and it's fortunate. I mean, the years that I've been in the industry, I have seen it has become confusing, and so I do want to say that more and more people do want and need the help of a broker to help them understand everything, understand the plans, and unfortunately, almost every year changes are coming. Every year there was a major change in coming into 2025, and that caused a lot of confusion. So back to what you're saying about the G. If somebody is going to get a supplement, one of the most comprehensive supplements that someone can buy in Dallas Fort Worth today is
Mhm.
called a Plan G supplement. And so that's why I mentioned Part G. There are other ones, but Plan G is probably the best
And
supplement.
that
I
was
don't repeat
the Medigap.
superlatives.
Was that the
That's the
Medigap?
Medigap. That's the Medigap.
Okay.
But if you don't do a Medigap, because remember, Medigap means you pay extra money. You pay a fee, you pay a premium, and on top of the premium, you pay for a drug plan. And that premium is not a fixed premium; it's going up. And I used to tell people it was going up once a year, and last year I found it went up after 6 months. So
Mm.
things keep changing. But I do caution people that this is the reality of a supplement. They are not a fixed cost. It's going up like our home and our cars. And we're dealing with this with our home and our cars every year with the prices going up, the deductibles going up. So the supplement is that way. The Advantage plan being zero premium is a nice option for people, but I will remind you that the Advantage plan has a network. So with that, people are held to using the doctors, hospitals, specialists, rehab, whomever's contracted with that network for that Advantage plan. So all Advantage plans are not equal. You have some Advantage plans that are better contracted, better financially stable, better with their customer service. Those things do matter. Even though they may both look like zero premium, they're not all equal. And then on the commercials, I noticed that they'll start to sell everybody on, oh, you can get $180 a month.
For
You can get
groceries.
this, you can
Yeah.
get that. What they're not saying is, yes, that's available if you have Medicare and Medicaid. So it's
Mm.
misrepresenting. And I get calls even from my clients, and they'll say, Cheray, did you forget something? Is there something else I can get? How come I'm not getting that? And I have to re-educate them and say, well, Miss Such and Such, you don't have Medicare and Medicaid. Or there are some plans for veterans that give back money. Or there are plans for regular people that give back money. But if you get money back, like a rebate for your Part B, you're going to pay, instead of $20 for a specialist, you may pay $70 for a specialist.
Okay.
The money comes from somewhere. So if they give
So
you
let me
something
ask,
on the front end, they're going to take it somewhere else.
do the end participant, the plan user, do they hire you directly? Do they hire you indirectly? Are you assigned by the insurance companies or by the government to be an advisor to people who don't know how to navigate this minefield of all these letters and plans? And so how does that exactly work? If you're 65 looking to retire and you have all these plans out there, you don't know what to enroll in, do I call a broker up and start shopping around, or do I reach out to the insurance company, or reach out to the government and they assign me someone? I mean, how do I get the help that I need?
Okay, that's a great question. So there are many ways that people can get the help that they need. They can call Social Security, and Social Security might refer them to somebody. Medicare.gov is a main online resource for people who are on Medicare, medicare.gov.
Okay.
Myself as a broker, most people, I have doctors that refer me. I have churches that I speak at, women's groups, minority groups, veterans groups. I do a lot of educating and public speaking. And when I do the educating and public speaking, then people are aware of what I do, and they then have my name and number as a resource to reach out to me if they need help for themselves or their families. So when you have a broker, whomever that person is or whatnot, because I don't know that if you call United, they're not going to send you a broker's name. I don't think it doesn't work. Now, well, I will say this: if someone calls United or Aetna or whomever, it probably goes into a call center, and you might get somebody who's briefly licensed to try to help you. But I caution people that, you want to get somebody who's experienced, who knows your area, who's had time in this industry, because it can get complicated. And some people start in it for a year or two and think it's too much for them and they quit. So you want to find someone that's knowledgeable, of integrity. An agent should check their doctors, a patient specialist, their hospital, their any kind of ancillary services they're using. That's important. And whomever a person uses, they don't pay me directly. For example, myself as a broker, I'm paid by the insurance company. So there's no fee or for my service to the client. When I do business, the insurance company pays me.
Okay.
There are a couple of comments and question on the chat line. I want to make sure that if we haven't covered them, that we do.
Let's get all the questions in, Tom.
One from Cousin Audrey K. Doesn't private insurance companies offer Medicare Advantage without paying 20% and no PCP copays?
Private insurance?
Yes, it says, doesn't private insurance companies offer Medicare Advantage without paying 20% and no PCP copays?
Okay, so maybe they're saying the same thing I mentioned after, like
That's
private insurance companies contract with Medicare. That's what an Advantage plan is. An Advantage plan, Medicare is paying Blue Cross or United or Humana, which are private companies, and they're paying them each month, and the consumer's not paying for the premium for that Advantage plan. And when they're on that private Advantage plan with a private company, they typically have a zero premium to the PCP, and then their co-payments for their specialist. So yes, that is correct. That's probably what we're defined as an Advantage plan, which I said is also equal to Part C.
Gotcha. The second question is really more of a statement. It says, greetings. This is from Brother Harrington, Gregory Harrington. This healthcare this discussion definitely needs to retain Obamacare attributes. The main one is keeping coverage for pre-existing conditions. Some are trying to deny pre-existing conditions. And I think I understand where he's coming from in terms of, I guess, maybe transitioning into Medicare. Are there any challenges for folks with pre-existing conditions? And that was one of the...
Yeah, that's a good question. So a lot to unpack there. The supplement, if someone chooses a supplement, they have 6 months from when they first turn 65 to get guaranteed issue. Guaranteed issue means no health questions asked. That's just the law of a supplement. After 65 and a half, they can be rated based on their health and their age and different things like that. They look at your zip code, your health, your age. But on an Advantage plan, there are no health questions because, again, it's just an extension of your Medicare benefits. And private companies, whomever someone chooses, Medicare pays that money each month, and there's no health questions asked. So that doesn't come into play with Advantage plans at all.
So if you have a
If someone
pre-existing
has
condition,
cancer
then
or
you're covered.
kidney or dialysis, it does not prevent someone from joining an Advantage plan.
Okay.
Supplements are different. They have to come in that first 6 months window, or if someone works until 68, they've got 60. They've got a, excuse me, I may be not correct on this. It may be 6 months. If somebody works beyond 65, they do have a window too that they're able to get a supplement guaranteed issue. But only the supplements have that window, and then they have to go through being approved or underwriting. Advantage plans have no underwriting at all because it's really an extension of people's Medicare. And the requirements is that you got to live within the zip codes and you have to have Medicare A and B. That's the requirement to be part of an Advantage plan. So there are no health questions that prevent anybody from being part of a Medicare Advantage plan. Now, the ACA, what he mentioned, is a whole different thing for under 65, ACA being the health, otherwise known as
Affordable Care
Obamacare,
Act. Affordable Care Act.
Care Act. Yeah, that is right now. We can still, and I do that as well. I do write for that as well. People can get insurance without any health questions asked currently. Now, the administration we have may change that or may not even keep it for 2026.
Gotcha. There's another question, very interesting question from Edward Willis. He says, how can one, or maybe this is a better question, if one can, how can one use Medicare if they retire abroad? Are there advantage plans that covers one abroad? Otherwise,
No, that's a good question.
yeah.
I mean, if you're traveling in the United States, you're covered anywhere on an Advantage plan in emergency and urgently needed care, but it does not cover outside of the United States. And you can't, like, I know a lot of people are starting to think about moving
Yes.
away from the United States, and maybe that's why this question has come up, but you will not be able to exercise your Medicare or Medicare Advantage outside of the United States, not even in an emergency.
Gotcha.
That emergency and urgently care needed clause in an Advantage plan is within the United States territories.
So if something pops off, you got to come back to the U.S. to get your coverage.
You do have to come back to get your coverage.
Okay, no, that makes complete sense. And you brought up another interesting question, or something that kind of provoked another question. Let's say that you're working past 65, you're still working for a company, 68 or whatever the case is. Do you stay on your company's private insurance, or are you forced to get onto Medicare after 65? Or if, let's say, you work to 68 or 70, what happens if and when you retire or they give you the boot and you're over 65?
Well, so Medicare allows that you don't have to take Part B if you're going to work beyond 65. So if there are a lot of people who are choosing to retire at age 67 or 68, and you can choose to keep your company's insurance, but not all company insurance is equal either. So when I meet with people, I evaluate with them, would it be more advantageous for you to take advantage of Medicare and use these plans that have zero deductible and your primary care is zero, your specialist is 20? Or was it more advantageous for you to stay with your company? That depends on the cost of the company insurance, the deductible people have. So it's a case by case situation. But anybody who chooses to work does not have to take Part B. They will not be penalized. They can opt to take it later. And then that Medicare, when you do retire, Medicare and the company you choose to use, whichever private company you choose to get an Advantage plan with, a lot of times they'll ask for documentation. There's a form from your employer that proves that you have what they call credible coverage. You are covered under what Medicare calls credible coverage, and so therefore you're not in any danger of a penalty, but you do need to prove it so that you're not going to be penalized. But as far as, I can't make a blanket statement and say that the company insurance is automatically better than what Medicare Advantage plans are. If someone's working for a large company, generally that's the case. But I've seen some people that said they were paying $560 a month with a $5,000 deductible. That's not better. You see what I'm saying? So it depends on what people's insurance is.
So when you take on a client, you actually have some work to do.
I do.
With comparing what they currently have against what they potentially could have with Medicaid, Medicare, all these different plans, evaluating the cost. So I guess not all just cost, but that's part of it also, and coverage. Yeah, so there's a lot more. There's a lot of work involved here when you take on someone. It's not just, here's a supplement G, go buy it and let me get my commission check and move on.
That's right. There's a lot to unpack. And And I know it sounds complicated, but I think for myself, it's a blessing that I have been in it for such a long time that it has become probably second nature for me.
Uh-huh.
But yes, it does require, as I said, a good broker is going to look at what you have, look at the options, look at your doctors, look at your specialists, look at your hospitals, your rehabs. You can't just sign people on. Look at your medications. That's part of the fact finding as a consultant to put someone on the right fit for them. And then every year I evaluate with my clients, you want to stay as you are or do you want to move? Because even though open enrollment comes every year, it starts October 15th, it ends December 7th. They don't have to change. It's just an opportunity for people to make a change. It's different than our jobs. Every year at our jobs, we were changing every year. When a Medicare client does not have to change every year. It's a time that they have the option to make
Okay.
a change if they want to between October 15th and December 7th.
What if they retire outside of that October the 15th through December the 7th? For instance, let's say it's 2025 and open enrollment is already happening. Let's say they turn 65 in February of this
Yeah,
year.
yeah.
What do they do?
Well,
If they decide to-
that's a great question. So there's a joke that I have told my friends. My parents will sometimes say, "Open enrollment's over. Aren't you done working?" And I say, "Mom, people retire and turn 65 every day. So anybody who's just retiring or just turning 65, they're not held to that open enrollment. That's for existing people on Medicare.
Okay.
Anybody who's just turning 65 has 3 months before their birthday, the month of their birthday, and 3 months after their birthday to make a decision. Anybody retiring typically has, I think it's 60 to 90 days from the time they leave their company to make a decision. So I'm constantly signing up people and talking to people all throughout the year. May not be the same amount because open enrollment, it feels like drinking water from a fire hydrant as far as the amount of calls and questions and during that 6 to 8 week period, it's a lot. But after that, there's still people who are retiring or aging 65. We call it aging in every single day. And they have what you call the special election period that allows them to have their right to get on a plan.
All right, I have a couple of more questions on here. One from Audrey K. Some companies convert Medicare 165 and they are the secondary to cover Medicare does not pay for. I'll repeat that. Some large companies convert Medicare as primary once the secondary to cover what a Medicare doesn't pay. Make sense? So the
It
Medicare
does, and I don't
the
only
company becomes secondary.
Yes, and I don't normally get in the weeds of that. There are some companies that will tell their employees that choose to stay with Medicare, and it's at that point that we're primary and they're secondary. That is true. I can tell you exactly which companies do that or don't, but normally you have an administrator at your HR that will talk with you when you are Medicare eligible. And if you choose to keep a company insurance, then they'll probably guide you as to if they are primary and the Medicare secondary.
All right, there's another question
Okay.
from Ms. Celia. Says, are there plans that include choices for PPOs versus HMOs?
That's a good question. I was going to go into that next. Great question. So with the Advantage plan, I want to continue that on that vein. You have the option of HMOs and PPOs. The HMO means Health Maintenance Organization. I mentioned most HMOs, you have to use a network. The nice thing about Advantage plans is they also have a PPO option, which means Preferred Provider Organization. And in that, you have a network, but you can also go out of the network. So yes, with an Advantage plan, you've got two different options, and you have that opportunity to do an HMO or PPO. Keep in mind, HMO co-payments are going to be lower, and a PPO, because you have more flexibility and you have the right to go out of network, you can expect to have higher co-payments, higher cost sharing, because you have flexibility, but it's still a great option.
Okay.
All right. And what we're going to do, folks, we're right at about 1/4 till the hour. And what I'm going to do for just a second is pull up Ms. Cheray Scott's card so you can see that. I've been kind of filtering it with her contact information at the bottom. But since I have that, I'm going to go ahead and pull up her card for about maybe 30 seconds so you can see that. If you want to take a picture of this with your phone, get her contact information for a consultation to learn a little bit more about, where you may be about to make a decision concerning retirement, or maybe this is for parents and you want to get some more information regarding their Medicare plan or what their options are. So make sure you take a picture of this and get this information down so that you have the best resources available at your disposal, because of course that is kind of what we do on Black Men Speak. We bring the best resources available.
We absolutely do.
All right. Now we are back, and we're going to if you have the questions, you get them in real quick. These have been some great questions, but don't come in with 2 minutes left and then all of a sudden, no, we ain't got time in. So, all right, a couple of other things. You mentioned Medicaid a little bit earlier, which kind of added some other benefits. For those who aren't in that space, what's the difference between Medicare and Medicaid?
Yes. Okay. So Medicare is well, first of all, Medicaid is a welfare program, aid for lower income. So it's a social welfare program, and certain people, they don't call Social Security. You go to your Texas Department of Human Resources and apply. You can call 211 or go to the office and apply. Typically in Texas, I'm seeing people who have a retirement income of maybe just short of $1,000 or right at $1,000 may qualify for some type of Medicaid. And then Medicare is just a social medical plan that was developed by I forget.
Gotcha. So, looks like she may have fell out there.
Well, Cheray for a minute.
Yep. I'm pretty sure she will jump back on in just a second. She may have fallen off, but no, this is great information. I really want to thank all of our guests for the great questions that we're asking. We're going to give her a couple of minutes to jump back on so that we can get to any other questions.
Well, I have a warning for the people out there, Tom, watching the show. If you didn't write down the information, after the show, if you want our information, $5, and I'll send it to you. You got to take advantage of these opportunities, Tom. There's got to be a penalty. We flash the information, people don't write it down. So yeah, if you want our information, Cheray information after the show, $5, Tom.
All right. Well, y'all better get this information now. I'm going to go ahead and pull up her card again so y'all can get her information and reach out to her to make sure that you have a consultation to get more information on this. So we don't
think that you have to wait until you're 65, 67, 68, whatever it is, Tom. She also says she do other insurance. So you may just want to do a review to see if what you have, either with a company or insurance that you've went out and bought, or even Obamacare, to see if that's what's best for you at the time. So it sounds like Cheray is very good at comparing plans and helping you navigate, and it doesn't cost you anything. So people, record her contact information, give her a call. Don't bombard her during enrollment season because she gets a lot of calls during then. But after enrollment is over, she's got a little breathing room. Yeah, reach out to her and let her know, hey, here's the plan that I currently have. Is there anything better out there, cheaper, or should I just stick with what I have? And let her do a comprehensive review of what you have and advise you.
True.
I'm going to record her information and keep her on. Well, people don't have Rolodex anymore, but we do have contact. There we go.
I'm sorry, technical difficulty.
Yeah, so it looks like your laptop probably ran out of juice.
It did.
And you're on your phone now. I can tell. Yeah, because your
Yes,
mobile phone,
yes.
because your mobile phone
As
always
Mr.
has a
Stewart
very
alluded to,
short
I
memory. So
use my
anyway,
tools quite a bit throughout the day, and I apologize. It wasn't juiced up enough for
all right,
this,
good deal. Well,
but thank you
we
for.
got a couple of questions here for
Before we
Stacey.
continue, Tom, real quick,
Yes.
Miss Cheray, I did while you were gone. Told people to record your information. I'm gonna charge them if they call after the show to get your information. Um, but I also encourage people to reach out to you to compare whatever plans they have, public, private, it doesn't matter, but not to bombard you during enrollment season because you mentioned that you get a lot of calls during that time. I think you equated to a fire hose, a person drinking out of a fire hose. So wait till after enrollment season is over with. But whether you
Well,
have,
if I may say, may I say something? Because sometimes I get calls or people come to my presentations and they're 50 years old or 48 years old and they want to ask me about Medicare for themselves. And I want to just, I appreciate that people want to get that information but that's a little premature because Medicare is changing every year and Medicare is typically for people who are 65 or if they are disabled for 2 years or
If they have a
more.
disability.
And the doctor has to sign off on that and they have to get the Medicare through Social Security. So if they're looking for help with their parents, certainly, but if you're 50 or 52 and you want to know what your Medicare is going to look like, I don't even know that yet because the government, I don't know what 2026 is going to completely look like right now because there's so much change. One thing we can be certain of is that there is a lot of change and our world is changing more rapidly. And there's so much more uncertainty that every year is a different year. But if someone has Medicare coming up within the next 3, 6 months to a year, certainly I'd be able to advise them or
what
help
if I'm
them.
in my 40s or 50s and just want to compare what I have to see if what I have is decent or good, or is there anything out there better for me? Do you do those kind of reviews?
I will be transparent and say that most times commercial plans, if someone has a company plan, they're
Hmm.
better off staying with their company plan than coming to the ACA. The Affordable Care Act is an
Okay,
option, but it's not better than commercial plans. And they
got
look
it.
at your income, they look at your household income, they will look at your taxes. It's very invasive. And if for some reason you have a certain amount of income, you probably don't qualify for a subsidy. It's 99% chance I'm not going to be able to do better for
Okay,
someone who is employed with a company. But when it comes to Medicare, or someone who's unemployed, or someone who's in between, like sometimes I do have people from age 60 to 61, 62, 63 who don't have Medicare yet rather, and they want insurance. I'm speaking to some of those people. If they quit their jobs, they've started their own companies. A lot of people who self-employed like myself do need the ACA. But open enrollment has closed for this year. And unless somebody just recently lost a job, the window for someone to even buy the ACA for 2025 is closed.
okay. Well, I take back what I
All
said.
right. So,
So
That's
I'm
okay.
all
glad
right.
I'm glad you
Couple of
clarified
questions.
it. Thank you.
We have a couple of questions here, and then we probably have about 5 or 6 minutes before we're out of time. This is from Mr. Edward. Once you choose an Advantage plan, can you revert back to the Medicare indemnity plan, Medicare, that pays the 80%?
That's a good question. If somebody wants to get off an Advantage plan and go back to traditional Medicare, yes, you can. You can
Right.
call your carrier, the private company. You can call Social Security. And typically, if someone's on, for example, if someone is on Medicare, an Advantage plan in February, and they call Social Security, they'll be taken off by March 1st.
Okay, that's
And
quick.
there are times in some people in a senior's life that sometimes traditional Medicare becomes better for them. For example, if somebody is on hospice, they're typically taken back and put on traditional Medicare.
Okay,
If somebody is in a skilled nursing facility and there are some challenges with the Advantage plan, there may be a time for the family and their parents that it's better for them to go back to traditional Medicare in certain skilled nursing facilities, things like that.
So there are certain things, if I'm understanding you correctly, that the traditional Medicare plan covers that, what is it? The Advantage plan does.
There are certain times, occasionally, typically I see this when people are aging and there's a lot of extreme situations that it may be better for them to go back to traditional Medicare, especially hospice. Typically, they're taken off Advantage plans and put back on traditional Medicare because that covers hospice fully.
Gotcha.
Okay.
And then there's one other question from Brother Gregory. What about
All right,
HSA
you're
plans
breaking up a
for
little bit. So repeat what you
ACA?
said.
Plans for Affordable Care Act.
Savings accounts. Okay.
Um, HSA plans, that's just a choice if you choose to go with a high deductible plan that is available when open enrollment comes. Yes, they do have options where you can take a high deductible plan and then have an HSA. I don't personally set up HSAs. That's not something I do, but that is available. There is one other point I'd like to say before we get cut off here. With Advantage plans and Medicare, back to Advantage plans and Medicare or anything, these plans also do cover home health. That is available. Home health is when a nurse may come out once a week. Physical therapy may come out a couple times a week to help your aging parents with fall balance or after surgery. And that is covered under Advantage plan. And people need to know that. Your
Okay.
doctor, you call your doctor, have them write a prescription, and you can ask for a company if you know one, or tell them to refer you to a company to help your parent with intermittent care. And that, again, that's a nurse maybe once a week. It may allow aid once a week and physical therapy 2 or 3 times a week. But that is not to be confused with long-term care. Medicare nor Advantage plans are long-term care. If people want long-term care, that's a separate policy or program. And we do offer different things to help with long-term care, cancer, and indemnity policies that pick up money, though there are other things that people add to Advantage plans.
And
Gotcha.
also, Ms. Cheray, I wouldn't let Tommy cut you off, so you don't have to worry about the time issue.
All right. Well, we have about a couple of minutes left. So why
We
don't
got
we
a couple minutes left.
right, any closing statements that you would like to make before we end the show? We so appreciate you coming out. Great information, a lot of good questions. So we'll give you a little time to make any closing statements. Then I'll pull up your final card, and then we'll close out this week's show.
Yeah.
Well, one thing with the closeout, if a person was interested in getting into this line of business, what would you recommend? And do you take on, do you mentor others who are trying to break into the industry?
Yeah, that's a good question. So I am I have a GA contract, which means I do coach people and train people who would like to get into the industry. I do want to be transparent that with almost any business, it does take about 2 to 3 years, possibly 4 years, before you will see a consistent stream of income.
Mm,
But there are a lot of seniors out here that need help. They need people who care, who want to do the learning and educating. And if you feel that you're interested in something like this, I do coach people and work with people. You do have to have your license in Texas. Your general lines license requiring your life insurance and health has to be done. We have certifications that have to be done every year for Medicare, and also each company you represent, you have to study and test for each company. So there
wow.
is quite a
Okay.
bit of studying because we are talking about people's lives and their health. But yes, if there's someone who has a license and interested, I'd be happy to work with them.
So a lot of bologna sandwiches until you can go get a steak dinner. Is what I heard.
That is true.
Okay.
All right.
Well,
All
at
right.
least you were upfront about it. So
All right. Well, folks, that is it for this evening. We hope you have enjoyed this information. It's very informative. Of course, we'll have to have you back because we talked about a couple of other things that we didn't even begin to touch. Of course, pre-needs and that kind of thing. So we're definitely going to have to schedule you back. And so,
okay, we lost Tom. I knew that was coming. But yes, we would definitely have you back, Ms. Cheray. And just let us know what your availability is. We generally try to, book people to come back 3 to 6 months when they have a very interesting topic to talk about. So you have a great one, and it's a service that people need. We're all getting older, and we're all going to need your service at some point. So it's good to have you, not in the Rolodex, but in the contact list. and know who to call, because like I said, all these alphabet plans out there, no one outside of someone like you understand what all these plans are. So glad that they have people like you who do this to help things, to help make it clear for the rest of us. And yeah, we want to do everything we can to promote your business and make sure people can find you when it's their turn to make these kind of decisions. So I'm gonna give you the
Absolutely. And
last
also,
word.
we are also here to help people's aunties, parents, moms, dads, because
There you go.
they're confused and they need help a lot of times. So I often deal with kids helping their parents as well.
I'm a pretty smart guy, and I'm confused. All these different plans and letters they throw out. So I'm gonna give you the last word, Miss Cheray, and then we're gonna close out.
Well, that's really all I have to say. I just want to just thank you and Tommy. I hate that
Okay.
he had technical difficulties like I have, but that's life. But thank you all for giving me the opportunity, and I look forward to helping educate with other
Thank
things.
you so much, and don't be a stranger.
Oh, thank you, sir.